So today we're going to talk about a few specific problems unique to females in the female wrist. So we'll review why the female wrist is different, and we're going to talk about three specific problems. One being carpal tunnel syndrome, the second being de Quervain's tenosynovitis or de Quervain's tendinitis, and the third being arthritis at the base of the thumb. So what makes the female wrist different? Well, there are a number of things that you'll see as a recurrent theme in today's talks. For one, there's greater ligamentous laxity in the hand and wrist in women, specifically at the base of the thumb, and we'll talk about its implications with arthritis. There are hormones that influence this, specifically relaxin, which we'll talk about. There's difference in the physiology of women as they're pregnant compared to non-pregnant women, and there are changes in the hand and wrist specific to pregnancy. There are also different sports and different activities that women do compared to men. As Alicia alluded to, lifting a 30-pound baby repeatedly throughout the week is a real workout, and it's a specific activity that puts stress on the wrist. There's also, although I won't specifically focus on this, the wrist is the most frequently broken bone of all fractures that we see, and women that have osteoporosis have specific risks for wrist fractures. But let's talk about our first specific condition. So what is carpal tunnel syndrome? Well, carpal tunnel syndrome is a frequently misunderstood term. A lot of people think any sort of pain in the hand or wrist is related to something called carpal tunnel syndrome. But carpal tunnel syndrome is a very specific phenomenon caused by increased pressure on the median nerve in the wrist. Now, the median nerve is a nerve that travels down the arm, and in the wrist and in the hand, it provides sensation to the thumb, index, middle finger, and part of the ring finger, and it also provides motor function to the powerful thenar muscles in the thumb. So the carpal tunnel is actually a tight, small tunnel in the wrist that's comprised of, let's see if I can get this pointer working, comprised of these carpal bones on the floor, and there's a ligament on the top of the carpal tunnel called the transverse carpal ligament. And within that tunnel, the median nerve shares a space with 9 other tendons that can squeeze or pinch the median nerve. So people who get carpal tunnel syndrome will have numbness and tingling, sometimes pain in the thumb, index, middle finger. Will be in this part of the hand here. Often the numbness and tingling will wake people up at night. They'll say, I have to shake my hand out at night. When the hand's elevated and flexed, for instance, when we drive or when we're on the phone, that tends to elicit symptoms. And when symptoms are severe, people will have constant numbness and sometimes weakness of the thumb. So although we often can ascribe a specific cause to any given case of carpal tunnel, the most common cause is swelling in the wrist caused by the lining of the flexor tendons. So this is the carpal tunnel here in a cross-section of the wrist. And the median nerve, which is this blue structure, shares the carpal tunnel with these 9 other tendons which bend the fingers and the thumb, and they have a lining called a tenosynovium which can expand and swell, and then it squeezes the nerve, causing these symptoms of numbness and tingling, and eventually weakness. Other causes of carpal tunnel syndrome include fractures, keeping the wrist bent for long periods of time. There's a strong genetic predisposition. Rarely space-occupying lesions like tumors can cause these symptoms. Carpal tunnel is extremely common overall. About 1 to 3.5 out of 100,000 people a year will suffer from carpal tunnel syndrome. Females get carpal tunnel syndrome overall more frequently than males, and 3% of women in their lifetime will carry at some point or another a diagnosis of carpal tunnel syndrome. But specifically during pregnancy, there's a much higher incidence of carpal tunnel syndrome, and that has to do with some of the physiologic changes during pregnancy where there are fluid shifts in the body, there's increased swelling, particularly in the soft tissues, including the hands, the feet, and the lining of those tendons that we talked about will also swell during pregnancy. So carpal tunnel is much more common during the 3rd trimester. It can cause those flexor tendon linings to swell again, squeezing the nerve. But fortunately, typically carpal tunnel symptoms resolve about 1 to 3 months after pregnancy. So how do we treat carpal tunnel syndrome associated with pregnancy? Well, avoiding activities that keep the wrist flexed or extended for long periods of time, take frequent breaks from activities like typing or repetitive wrist activities. We'll talk about splints and cortisone injections, which are very effective for temporary relief when someone's having a bad bout of carpal tunnel syndrome. And fortunately, in the setting of pregnancy, surgery is very rarely needed, as symptoms often resolve after childbirth. So night splints, we commonly sleep with our wrists bent or sometimes extended, And after hours of keeping the wrist bent, that will pinch the median nerve, which is already compromised. So these night splints, as you can see, will keep the wrist in a nice position where it's not too flexed or extended and provide more room for the wrist. And that's a very simple measure that often can help people sleep through the night. When that doesn't work, we'll often offer a cortisone injection. Cortisone is a powerful anti-inflammatory, and in this situation, it will shrink the lining of the tendons, giving the median nerve more room and reducing the symptoms of numbness and tingling. It can take a couple weeks, but it's effective in 60 to 80% of people within 6 weeks. So let's talk about our next problem that's much more common in female wrists. So Quervain's tenosynovitis, sort of a mouthful, but it was named after a doctor, Fritz de Quervain, in 1985. It's also called de Quervain's tendinitis, and it's basically a tendinitis caused by inflammation or irritation of the tendons that are at the base of the wrist and the thumb. There are two specific tendons. One is called the abductor pollicis longus, or the APL, and the second is called the extensor pollicis brevis, or the EPB. And these two tendons allow us to lift our wrist up and lift our thumbs up. So what activities are these tendons irritated in? Most frequently, new moms who are picking up their heavy babies throughout the day. Carpenters will get this using a hammer all day. Any activities where there's repetitive heavy lifting with this sort of motion. Patients will have localized inflammation and swelling. This condition has been termed new mommy's tendinitis because it's so frequent in new mothers because of the repetitive lifting and irritation of those tendons. So what happens is, this is a little schematic. You can see as these muscle bellies transition into tendons, they're in a tight fibroosseous tunnel, a tight sheath, and normally there's plenty of room, but with repetitive activity, this junction of the tendon and muscle swells. It causes friction as it rubs back and forth, and there's pain and decreased motion with increasing friction, and there's sort of a vicious cycle that's created. People have looked at histologically at the tendon sheaths of people that have this problem, and they're up to 5 times thicker than the normal tendon sheath. So symptoms include, often people will have a bump or swelling on the side of the wrist. There'll be pain right on this little sort of bony point on the wrist, which is called the radial styloid. There's pain with making a fist, and one very good test you can all try, it's called the Finkelstein's test. Grab your thumb in a fist, and then you bend the wrist into ulnar deviation. So that feels a little tight or uncomfortable for most people, but people who have real de Quervain's tendinitis will have extreme pain with that activity, as it really forces those tight tendons into the thickened sheath. De Quervain's tenosynovitis is much more common in women, about 6 times more common than men. It's common postpartum, and again, other occupations that require heavy lifting will also sustain this problem. Fortunately, it's often self-limited. It goes away with decreasing the activities. For women that have de Quervain's in the setting of having a new baby, you can take anti-inflammatories if you're not breastfeeding. A thumb spica splint can be very effective, which is a splint which spans the wrist and thumb, so it immobilizes those inflamed tendons. And a cortisone injection, again, can be very effective because it shrinks the lining both of the tendons and that fibroosseous tunnel, so it allows more room and prevents that painful friction. Some patients will require surgery if they don't get better with these simple measures, and we can do this often as a minimally invasive surgery with a very small incision, and we're literally just incising or increasing the room for this tight tendon sheath. So we make a small slit in the tendon, and the volume of that sheath increases significantly so that those inflamed tendons can glide back and forth without being squeezed or without friction. So in our whirlwind tour of the female wrist, we'll talk about our last common condition, which is arthritis at the base of the thumb. So this is called basal joint arthritis of the thumb, or CMC arthritis. It's basically a degeneration of where the cartilage, where the thumb metacarpal bone meets the wrist bone, which is called the trapezium. You can see in this diagram here, the cartilage will break down, bone spurs form, and the joint space decreases. So it can be caused by trauma. It's frequently seen in osteoarthritis. It can be seen in inflammatory arthritis, like rheumatoid arthritis. Patients will have pain with thumb motion. In some ways, it's similar symptoms to de Quervain's, but it affects a different population. There'll be swelling, sometimes a deformity at the base of the thumb, as you can see in this picture on the bottom left in a more advanced case. patients will say, it doesn't hurt all the time, but my thumb kills me when I open a jar, I open a pill bottle, I turn a doorknob. Yoga can be very painful. Patients will often say downward dog is very painful, and that's because you're putting stress right at that trapezium metacarpal joint, right at that basal joint, which is injured. This, again, is much, much more common in women than men, 7 times more common. And it's common in young women, women over the age of 40. It's not like hip or knee arthritis, which more frequently affects older patients. So to understand why people are prone to basal joint arthritis and why women in particular, let's just briefly look at this joint. So the basal joint of the thumb, where the metacarpal meets the trapezium, it's an unstable joint inherently. It's sort of a floppy joint for everyone. And at rest, the joint's very loose, and it's only with thumb opposition, with pinching and with bringing your thumb over, that the muscles and the ligaments tighten up to form a stable joint. We believe that this inherent instability over years, as the tremendous forces go through the base of the thumb, wears out portions of the thumb, and that's where patients will sometimes present with this x-ray, where there's no cartilage left, the joint space is decreased, and that's from years of repetitive force through that joint, which is inherently unstable. So investigators have postulated that laxity and attenuation of the supporting ligaments at the base of the thumb causes basal joint arthritis, and without the stability that we have in various joints, there's abnormal loading of various areas of the cartilage, and it can lead to deterioration of the cartilage. So some very interesting research has been done recently, mostly by a doctor, Jennifer Wolf, who's alumnus of where I trained and did my hand surgery training at the Mayo Clinic, and she discovered the role of a hormone, relaxin. So we're going to hear more about relaxin today, but it's a reproductive hormone that acts to loosen the pelvic ligaments for childbirth, but it's also present in non-pregnant women and in men. It's thought to mediate joint laxity and also regulate collagen deposition and degradation, so it can influence the tightness or the looseness of ligaments. And a specific role for relaxin at the base of the thumb has been identified. So one of Dr. Wolf's studies identified about 300 volunteers and looked at circulating levels of relaxin in their blood. Patients that had detectable levels of relaxin had a looser thumb joint, but they did not have more laxity anywhere else in their body. So specifically was associated with increasing looseness at the thumb joint. Also, we've found relaxin receptors in the ligaments of the thumb, and they're in higher concentration in women compared to men. So in any case, how do we treat basal joint arthritis? Well, similarly to these other conditions, there are a number of effective non-operative treatments. So the first thing I tell patients is modify your activities. When it hurts to do yoga activities or push-ups, I'll say do a downward dog resting on your forearm or in a neutral grip. Do not put weight on a hyperextended wrist. Oral or topical anti-inflammatories are quite effective. A daytime flexible splint and a nighttime rigid splint can immobilize that joint which is painful to move and allow for motion of the other joints around the hand and wrist. Cortisone injections, again, can be very effective and provide temporary or sometimes lasting relief. And I think in the future, we're going to possibly see a role to target relaxin in the treatment of basal joint arthritis. I could do a whole talk on the surgical treatment of basal joint arthritis because it's there are numerous surgical options to treat this problem, but I'll just conclude with a brief slide here. So all the treatments that are generally most effective to treat basal joint arthritis when a patient has severe enough symptoms that it requires surgery, if we simply take out this arthritic bone, as you can see on the slide on the left, the trapezium, that almost always provides excellent pain relief and restoration of function. So that's called a trapeziectomy. Many surgeons also have some modification of this surgery where we'll tighten up the ligaments at the base of the thumb and provide a cushion with a strip of our own tendon. And that's, I favor a form of that type of surgery, which has been very effective in patients. But so we've reviewed 3 common conditions in the female wrist, and thank you for your time. We'll proceed with our next talk.